Now, the World Health Organization says the number of children using vapes is alarmingly high. In its first ever estimates, the UN body says more than 100 million people vape around the world, and that this includes at least 86 million adults, mostly in high-income countries, as well as almost 15 million children between the ages of 13 and 15. It warned that the tobacco industry was aggressively marketing the products meant to help people stop smoking to hook young people on nicotine at an earlier age. This, the WHO says, risks undermining decades of progress. Well, joining us live now on the programme is Dr. Bonnie Halpern-Felscher, Professor of Paediatrics and Adolescent Medicine and a developmental psychologist at Stanford University's School of Medicine. Dr. Halpern-Felscher, good to see you. Thank you very much for being with us. Now, full disclosure, I'm neither a smoker nor a vapor. Why is this so suddenly, very quickly, so popular?
Well, first of all, thank you for having me. And I, too, have never smoked or vaped anything in my life, but I'm very concerned about young people who are. So we've been seeing an increase in e-cigarette use, we would call it, in the United States and globally, actually for a few years. I've been involved in a lot of work across the globe right now where we're seeing heightened levels. We're seeing this more recently as well, largely because of the new products that are on the market, the flavors. A lot of times these electronic cigarettes or vapes come in cherry and fruit and sweet and candy flavors that young people really like. And they have a lot of misperceptions. They think that they're harmless. And when we advertise them as being okay or safer than cigarettes or whatever it might be, even though there's not much evidence for that, we really start enhancing and appealing to young people to go ahead and use these products.
But many countries, Britain, France, Germany, here in the United States, do have regulations. You can't just sell these to a 7-year-old. Are those regulations not enough?
No, it's absolutely correct. In the United States, we have that you have to be at least 21, and across other countries, it's 16, 18, or 21, depending on the country that you're in. But unfortunately, it's not hard for a young person. I was recently in the UK. It's pretty easy for a young person to still get those products, to buy them underage, or for somebody who's a little bit older to buy them for them, or to get a fake identification, or to get them online. It's not very hard to get them. And we're sometimes in some places seeing young people as young as second or third grade, so 8 or 9 years old, using these vaping products.
You used the word safer earlier with a big question mark over it. How much do we know about how safe or unsafe vapes are?
So more and more research is very clearly showing that e-cigarettes or vapes, first of all, have a tremendous amount of nicotine. The newer products have as much nicotine as what we would see in several packs of cigarettes, so sometimes cartons of cigarettes. And so that is not safe to the developing adolescent and young adult brain. You're changing the brain and making us so much more likely to become addicted. But more and more research is showing that e-cigarettes are just about, if not as harmful to your heart and your lungs as are general cigarettes, and also some emerging research suggesting that we're going to start seeing risks for cancer. So these are really, one of my friends used to say you could jump from a 15-story building or a 10-story building, the results are the same.
And if I can come in on that, though, tobacco companies do say that they try and do their bit and that these are all about getting adults off cigarettes.
Absolutely. And I would love that to be the case. But most of the research shows that in population studies and as consumers use them, e-cigarettes do not help adults quit cigarette smoking. And instead, what we're doing is attracting kids to be using these products. And that's what I'm most concerned about. Kids are not using e-cigarettes instead of cigarettes. They're starting with e-cigarettes. So your question on regulation, we need way more regulation and we need enforcement of those regulations.
Okay, Dr. Bonnie Halpern-Felscher from Stanford University School of Medicine. Dr. Halpern-Felscher, thank you very much for being with us.
Thank you.